So much for joining us for this town hall. I'm here with Dr. Muntu Davis, the LA County Health Officer, Dr. Eloisa Gonzalez, Director of Cardiovascular and School Health, and Dr. Dawn Tarasita, Associate Director of Acute Communicable Disease Control Program. To start, I want to tell you a little bit about how the town hall will go. We'll begin with some brief remarks from our panelists, and then we'll spend the rest of our time answering your questions. Thanks to everyone who already submitted questions. And as a reminder, you can send in your questions during this presentation in the chat on YouTube, Facebook, or Twitter. As displayed at the top, we also have live translation services during our event tonight. Para escuchar en español, por favor, marcas 1-888-664-1453. For Mandarin, it's 1-888-664-1458. And for Korean, it's 1-888-664-1454. Before we move to opening remarks from our panelists, let me share the most current information on the COVID-19 pandemic. Unfortunately, we're seeing indications of a winter surge on the heels of the Thanksgiving holiday. Case rates and daily hospitalization admissions are steadily increasing, and we anticipate that they will continue to increase as we enter the winter holidays. The Center for Disease Control estimates that our weekly case rate is now 100 new cases a week per 100,000 residents. This reflects a jump up to a high level of transmission across the county. Currently, there are 770 people hospitalized with COVID-19, and that's an increase of 103 people just this past week. We continue to track the emergence of the Omicron variant, which was first confirmed in Africa in November and has since been found in 77 countries worldwide, and we have 30 cases here in LA County. Given what we already know, Omicron does pose a significant threat to our community. Based on information collected to date, we anticipate that Omicron will circulate more widely in LA County in the very near future, leading to many more cases over a short period of time, particularly given the increased gatherings and travel that we all enjoy over the winter holiday. Unvaccinated individuals remain at the highest risk, but all the evidence to date indicates that those fully vaccinated are also at increased risk, particularly for getting infected and infecting others, and particularly if they haven't yet received their booster dose. With cases already increasing and the threat of Omicron spreading and being more infectious during this winter holiday season, we'll all need to be smart and cautious as we celebrate. While things are not going in the direction that we wanted them to, we do have more tools to help protect ourselves this year than we had at this time last year, and we just urgently need to use them. One of the most important steps you can take right now is to get vaccinated, and if you've been vaccinated, please get boosted. Please also prepare to get tested for COVID if you're sick, you've been exposed to a known or a potential COVID case, you're preparing for or you're returning from travel, or you're gathering with others. And mask up when in indoor public spaces or crowded outdoor spaces, or frankly, anytime you're near someone you know to be vulnerable to the most severe outcomes of COVID infection. This is especially important so that we protect everyone who's still unvaccinated, including the 500,000 children under the age of 4, all of our friends and family members who are older, may be immunocompromised, or may have underlying health conditions. To prevent ourselves from getting into trouble over the holidays, we're asking everyone to take a lot of caution as you gather and celebrate. If we fail to take common sense safety measures right now, we could find ourselves in a dangerous place by the end of the month and into January, which could dramatically impede our recovery journey. We can prevent new threats from overwhelming us by being realistic about what we can do to protect each other. Get vaccinated and boosted, get tested, and wear a well-fitting mask. I know we can do this together. As a reminder, residents can walk into any public health vaccination site or make an appointment at the hundreds of sites across the county to get vaccinated. For more information, please visit vaccinatelacounty.com. Now I'd like to turn it over to Dr. Muntu Davis, our County Health Officer, for updates on the Omicron variant.
Thank you, Dr. Ferrer, and good evening to everyone joining us today. I'll be providing more information and updates on the Omicron variant, including how it's affecting us here in LA County. But let's start with what we know and what we don't know about the Omicron variant. First, with what we know that the Omicron variant has been designated as a variant of concern by the World Health Organization or our national Centers for Disease Control, or the CDC. This is because it has a large number of mutations in key regions of the virus which raise the potential for increased transmission, potential escape from vaccine protection, possible resistance to treatment, and possibly increased illness severity if infected with it. We're in the early stages of learning about the Omicron's ability to spread through populations and cause disease. Early data suggests this variant is spreading rapidly and may spread several times faster than the predominant strain that we're seeing here in LA County and across the world, the Delta variant. However, it does seem to be easily detected by existing rapid and PCR tests used to diagnose an infection, so that's a good thing. Most of the data so far suggests that the likelihood that current vaccines, particularly with boosters, still protect people from severe illness if infected with the Omicron variant. However, because most of these data come from laboratory studies and surveillance data rather than population-based studies, and because they haven't been reviewed by the broader scientific community, there are still more unknowns than knowns about the Omicron variant at this time. We will continue to provide updates as we and the world learns more week by week. As mentioned in terms of our cases, yesterday on December 15th, we had confirmed 18 cases of the Omicron variant here in Los Angeles County, with 8 new cases reported yesterday. 5 of the 8 cases were fully vaccinated, but none had received a booster. And today you'll see our press release, we reported another 12. Since vaccine effectiveness wanes over time, getting boosted becomes more important as we approach winter holidays and experience potentially increasing circulation of the Omicron variant in addition to the Delta variant. As Dr. Ferrer mentioned, preliminarily, evidence suggests that booster doses of vaccines may be enough to strengthen your protection against Omicron. As a reminder, booster doses are important for everyone ages 16 years and older, and are due at 6 months after your second dose of the Pfizer or Moderna vaccines, and due at 2 months after your first dose of the Johnson & Johnson vaccine. In particular, we must protect our most vulnerable, those 65 years and older. So far, we've boosted nearly 600,000, or 50% of those within that age group here in LA County. But that means that we still have yet another 50% left to go. A COVID-19 vaccine booster dose is the best holiday gift we can give to a loved one this season. More than 4.5 million residents are currently eligible to receive boosters. Remind your family members today, particularly our seniors, to get boosted. Don't wait, Omicron is here. We will be watching carefully for signs of exponential growth in cases of the Omicron variant or another variant. But meanwhile, there is no confusion on what steps we must take to protect ourselves from the possible triple threat of respiratory illness this winter, which includes flu, the Delta variant, and now the Omicron variant. Vaccination against both influenza and COVID-19 remain our most powerful shield to protect ourselves and our loved ones and friends. We need to increase our vaccination coverage and be sure that those eligible for boosters are getting booster doses when they're due, as the evidence continues to mount showing that the primary vaccine series does lose some of their potency over time. As a reminder, vaccinations are free. They're widely available for everyone 5 years and older. Booster doses are available for eligible those 16 years and up. Many locations across LA County do not require an appointment. Please visit vaccinatelacounty.com for vaccination sites near you. Again, that's vaccinatelacounty.com. Additionally, public health provides in-home vaccination appointments for people who are homebound and are unable to visit a vaccination site. Again, please visit vaccinatelacounty.com to fill out the online request form or call Public Health, the Vaccine Call Center at 833-540-0473. And you'll see that number on your screen now, 833-540-0473. It's open daily from 8 a.m. to 8:30 p.m. We can all work collectively to do our part to help prevent the spread of COVID-19 and protect ourselves and our loved ones as we celebrate the winter holidays. Sending my warmest wishes to everyone for the upcoming holiday season. Now I turn it over to Dr. Don Tarasita, Associate Director of our Acute Communicable Disease Control Program, for more information on the importance of utilizing testing.
Good evening, and thank you for joining us. As Dr. Davis mentioned, as we get closer to the end of the year and continue to gather indoors with friends and loved ones for the holidays, I'd like to speak on the importance of testing and why we should continue to use it as a tool to combat this virus. Testing is an important tool in our toolkit as it helps us quickly detect cases and allows us to reduce spread. There are several types of tests available that allow us to know if we are currently infected with the COVID-19 virus, and this can be confusing. The first category of tests are antigen tests, also called rapid tests. These can be performed in a lab, a provider's office, a testing center, and include the over-the-counter home self-tests. The second group of tests are molecular tests, also referred to as PCR tests or nucleic acid amplification tests, or NATs. These tests are usually performed in a laboratory. The molecular tests are considered the most accurate tests for COVID-19 and are often used to confirm the results of the antigen tests. You can choose either type of these tests depending on when you need your results available. When you need results quickly, a rapid test is best. You can get results in about 15 to 30 minutes. You can use rapid tests if you think you may have been exposed to a known COVID case, if you have symptoms, before gathering indoors with others, especially those who are vulnerable, before or after travel, and after attending large events. If you have a positive rapid test, you must consider yourself infected and isolate immediately. You can consider getting a confirmatory molecular test to make sure. Rapid tests are generally a little bit less accurate than molecular tests, and these tests may result in a small number of people getting a negative test result when they're actually positive. If there's concern about the possibility of a false negative test, the test can be repeated 24 hours later. Lab-based PCR and molecular tests are less likely to result in an inaccurate test result, although like any test, a molecular test can have a very small number of both false positive or false negative tests. Also, an infected person can remain positive by molecular test for up to 90 days. The turnaround time for a lab result is also longer, usually around 1 to 2 days. For anyone who does test positive, you must stay isolated from others for at least 10 days from either the date of your symptoms or, if you do not have any symptoms, the date you tested positive. If you do have symptoms of COVID and get a negative test result from a rapid test, you should retest and get a molecular test to confirm that you do not have COVID. As a reminder, if you have symptoms that may be COVID, please remain home and stay away from others. Getting yourself tested for COVID is an effective way to keep yourself and your loved ones safe, especially as spending time together during this holiday. Even if you're fully vaccinated, getting tested before or after gatherings or parties and when you're feeling under the weather can make a difference in whether you expose someone you love to the virus. Testing at county sites are free, regardless of your immigration status and availability, and available in your community. Please remember, we can work together to spread holiday cheer this year, not COVID-19. Thank you very much. And now I'll turn it over to Dr. Gonzalez, who will discuss vaccine eligibility for those 5 to 17.
Thank you, Dr. Tarasita, and hello, everyone, and thank you for joining us this evening. It's a pleasure to be here with you all. So tonight, I'd like to discuss vaccinations for children ages 5 to 11 and the importance of getting our children vaccinated against COVID-19. It's now been over a month since the CDC recommended that children ages 5 to 11 get a COVID-19 vaccine, expanding the previous pediatric eligibility from 12 and up to now include kids ages 5 to 11. And as a reminder, only the Pfizer COVID-19 vaccine is the one that's been authorized for children and adolescents ages 5 and up as a 2-dose series taken 3 weeks apart. The pediatric dose for children ages 5 to 11 is also only 1/3 the dose compared to older adolescents and to adults. We get a lot of questions from parents, including why they should get their child vaccinated, and especially with a new vaccine such as this one. So these are the 3 key messages I want parents to know about. So first, COVID-19 is now one of the top 10 causes of death among children, and tens of thousands of children and teens have been hospitalized with COVID-19, sadly. The COVID-19 vaccine is the best way to protect your child from getting sick, being hospitalized, and from developing long-term symptoms. Second, having your child vaccinated will protect your family, particularly those who may be at high risk, like grandparents, or those who are not yet eligible for the vaccine, like siblings that are under the age of 5. And third, being vaccinated will help kids be kids. It'll enable them to safely do more of the activities they enjoy, like attending birthday and holiday parties, playing sports, staying in school, and spending time indoors with friends and their family. Furthermore, I want to reiterate that this vaccine is very safe. Before being authorized for children, scientists and medical experts completed their review of safety and effectiveness data from clinical trials of thousands of children. The Pfizer COVID-19 vaccine was rigorously tested and reviewed, and millions of teens have already safely received the COVID-19 vaccine. In fact, already more than over 5 million children ages 5 to 11 have safely received the vaccine to date. Finally, I'd also like to discuss the concerns parents may have around severe adverse reactions to the COVID-19 vaccine, including myocarditis, which is inflammation or swelling of the heart. The risk of a child having a serious adverse reaction to the COVID vaccine is very low. One rare complication that has been linked to the COVID-19 vaccine and was in the news is myocarditis. So the facts are this: myocarditis after vaccination is extremely rare. In fact, you're much more likely to develop myocarditis from COVID-19 itself, because myocarditis is actually a well-known complication of the virus. So thus, all in all, the vaccine is actually protective against myocarditis, especially compared to actually getting the actual infection. So again, vaccination is the best way that we can protect our children ages 5 and older from COVID-19 vaccines. Parents may have questions about keeping our youngest children and those not yet eligible for the vaccine safe during the holiday season and beyond. And we have the tools to protect children right now. Wearing a mask indoors or when your child is around people who you don't know their vaccination status is something that your family can do to keep your unvaccinated child safe. Masking plays a critical role in slowing the spread of COVID-19. Washing hands frequently and getting your flu shot keeps us all healthier during the winter months too. And finally, although we're not yet sure what the impact of the new Omicron variant will be, we know how to slow the spread of COVID. Our most effective tool remains vaccination. We encourage everyone 5 and older to get vaccinated and those 16 and older to get boosted as soon as possible. And as a reminder, residents can walk into any public health vaccination site or make an appointment at the hundreds of sites across the county to get vaccinated. And for more information, again, you can visit vaccinatelacounty.com or vacunatelosangeles.com. Thank you, and back to you, Dr. Ferrer.
Oh, thank you so much to Dr. Davis, Dr. Tarasita, and Dr. Gonzalez. I'm so glad that you were able to take time tonight and provide really important information to all of the people who live and work here in Los Angeles. I'm going to go. We've gotten a lot of questions already. I'm going to start going through them. I'm going to probably, ask one of our panelists to start answering, but I want to encourage panelists to please jump in whenever you have more information to add. Why don't I start with Dr. Tarasita, because This is a question that came up from multiple people, Dr. Tarasita, and I think it's top of mind for so many folks. I've had my Pfizer vaccinations and my booster. Is that going to protect me from this latest strain, Omicron, or do I need to take additional protections?
Yeah, that is a very good question and something that we would like to focus on. Those of you who are fully vaccinated do have some protection from the new variant Omicron. This would mean 2 doses of either Pfizer or Moderna or 1 dose of J&J. However, we have seen many studies that have shown that the protection from being fully vaccinated with these vaccines diminishes over time. And we do recommend you get the booster dose. Now, the good news is that with a booster dose, at least with the Pfizer vaccine, latest studies have shown that this has increased your effectiveness back up to like 70, 75%. So you do confer a lot of protection against the virus. Now, you do notice that this is only 70 to 75%, and you do still run the risk of getting Omicron if you're fully vaccinated plus booster. But again, it confers much safety. So please get your primary vaccine series as well as your booster. This is the most important thing you can do to protect yourself. Thank you. Dr. Furr, I think you're on mute.
Oh, I don't show being on mute. Can you hear me now? Okay, sorry. Yeah, so thank you so much, Dr. Tarasita. And I do want to add, because as Dr. Tarasita noted, it's good protection, it's not perfect. And when there's as much virus circulating as we have now in LA County, all of us who are fully vaccinated and even boosted, we're going to have to layer on some other protections, particularly people who are my age or older, you have underlying health conditions. We got to keep those masks nearby. We got to use them when we're inside. We shouldn't hesitate to ask people who are coming into our house and are going to be indoors with us for long periods of time for a gathering to go ahead and try to get tested before they come indoors to make sure that they're not, asymptomatic, no symptoms of illness, but in fact, positive for the virus. And when we go out and about, we have to make some good choices, you may want to avoid that big holiday party that's indoors at a hotel or that huge wedding that's going to have, 500 people, all eating and drinking together for hours on end. Because we know for some of us, those risks are going to be too significant for us to take right now with all of the transmission we have in our county. I'm going to go ahead, Dr. Davis. Lots of questions about this as well. I've got a 3-year-old desperate to get them vaccinated. What's happening with vaccines for our youngest children?
Thank you. I've heard that question as well. This is something that, as you look at the way that this rolled out, vaccines in particular, when they're new, we'll start out with adults and then move down into your younger age groups. And so I believe that's what's happening right now. I've seen some information around some clinical trials being underway for children age 6 months to under 5 years old. I suspect that we probably won't see the results of those trials or get any authorizations or approvals until next year, especially given the time we are right now. But that is the direction that things are going. And so hopefully it'll be sooner rather than later, or we won't need them, when we get to that point next year. You're muted, Dr. Ferrer.
Sorry. Dr. Gonzalez, feel free to chime in at any point as well, particularly in questions around children. But there is a question that I think is important. It was, a parent has sent this in, and I think there are lots of other examples as well about, I need some resources for my child to get them vaccinated. I have a child with a severe needle phobia. This isn't just sort of run-of-the-mill anxiety. Do you know of any resources that can be of help? I'm desperate to get my child vaccinated.
Right. So needle phobias can be very difficult, both for children and for their parents. So thank you for reaching out with the question. Actually, for extreme fears like a phobia is, it's really best to talk to a mental health provider to really understand how severe the problem is and make a plan for the best strategies to treat the actual phobia. So treatment for phobias can include counseling, exposure therapy, where a person gradually faces their fears with the support of a mental health provider and a carefully planned steps. And in some cases, the phobia treatment can include medication. So those would be some of the resources that I would recommend someone try to follow up with to deal with severe phobias.
Thank you so much. Dr. Tarasita, this is such a good question. And we ask this question ourselves all the time. Are we going to need to get a booster every 6 months? And how long do you think we're going to need these boosters? When will this pandemic end?
That is a very good question. The short answer is we don't know. We do not know of any further plans to continue boosters after 6 months. We will look to the science to guide us for this, but right now the recommendation is just get a single booster 6 months after your series ends of either Pfizer or Moderna, or 2 months after the J&J vaccine. Again, this is the best thing you can do to protect yourself, get the booster. We have no idea if there will be further boosters or a different vaccine further down the line.
Yeah, Dr. Tarashita, maybe we could just stay on this theme for a second. Will the Moderna vaccine work on the variants? We hear a lot about Pfizer. We don't hear about Moderna, particularly for Omicron. Should I get a different brand of a booster to just be safe?
Yeah, that's a good question. And not only do we discuss this a lot, like we wonder it for ourselves, like when we got our booster, should we get a different one? The current recommendation is just to get a booster. So regardless of what initial vaccine you received, get a booster. It could be either Pfizer, Moderna, or Johnson & Johnson. There's different theoretical advantages of mixing versus getting the same one. It really doesn't matter. The important thing is that you get your booster. They all, in theory, work the same way.
Yeah, and I think it's true. We do hear a lot about Pfizer. One reason for that is Pfizer was the vaccine that was used to vaccinate a lot of people in South Africa, and that's where Omicron first showed up. So, we hear a lot about how well Pfizer is working, and the booster for Pfizer, in part because it reflects the vaccines that were being used in these early countries that have seen the largest surges. But all evidence to date so far for Moderna is that it's a very powerful vaccine, and that boosters, Moderna boosters is going to provide you with a high level of protection as well. But we get asked these questions a lot. We think it's really important because with 3 different vaccines that were authorized in this country, it is right for people to wonder which one will work best for them. I think, as Dr. Tarashita said, the most important thing is get vaccinated, get boosted, because they all work and work fairly well, and they certainly work a lot better if you've got the doses than if you're unvaccinated. Dr. Davis, if we are fully vaccinated and we've had the booster, can we still be infected by others at events?
Well, as you heard Dr. Terashita talk about the vaccine's effectiveness and not being 100%, and that's been said from the beginning, no vaccine is 100%. So some will get infected or could get infected. But in general, your risk, having had both the primary vaccine series and the booster, in addition, if you're wearing a mask, help to really reduce your likelihood of being infected. But there's always that remote possibility. But again, having all of those doses, in addition to wearing your mask, are things that will help reduce your risk.
Yeah, I think I appreciate this because we talk a lot with all of our larger event venues, and I know our sports teams have just been incredible partners trying to help keep us all safe. But one thing, to think about sort of logically is the more people that you're around, and particularly if you're in close contact with lots and lots of different people, the greater your chance is going to be of getting infected. That's going to apply whether you're vaccinated or you're unvaccinated. So these very large events that we go to, if you're going to be in close contact with people, and as Dr. Davis mentioned, you're not going to be wearing that mask, or they're not going to be wearing that mask, because there's tens of thousands of people at some of these events, the chances that there are people there who are infected are pretty high. So you do have to be very cautious when you go to the larger events. You know, we encourage you to make sure you're vaccinated and boosted, make sure you're keeping a high quality mask on. That's a mask that fits you really well over your nose and your mouth. It has, 3 layers. We call it the 3-layered mask now, to really help filter out the virus. And then you're washing your hands a lot. Because, Dr. Davis is absolutely correct that your chances go up if you're vaccinated and boosted and wearing a mask. But your chances of running into infected people go up as well if you're at these large mega events. So take that into consideration, as you make your plans, and think about your own risks and the risks for people in your family. You live with a lot of people who are very high risk. You may want to delay for a while the kinds of activities you do that put you in a lot of contact with potentially other people who could be infected. Dr. Gonzalez, this is a great question that a parent has about who she should talk to before she vaccinates her child. Her husband is allergic to the ingredients in the Johnson & Johnson vaccine, and she had a reaction to Moderna. So she's worried that her child may have an allergic reaction. She's wondering what she should do and how helpful it might be for her to talk with her child's physician.
Thanks for that question, Dr. Ferrer. Yeah, so we always encourage folks to check with their medical provider if they have a specific concern about vaccination given their personal or their family's medical history. In general, though, whether or not a person with allergies can get a COVID-19 vaccine really depends on a number of factors. For example, people who are allergic to things like oral medication or food, including eggs, or to latex, pets, or pollen, or people who have a family history of allergies can be vaccinated in general. If you've had an allergic reaction to a vaccine or an injectable therapy in the past, even if it was not severe, we would encourage you to talk to your doctor to decide if it's safe to get vaccinated. And if you're allergic to polyethylene glycol or PEG, you should not get the Pfizer or Comirnaty or Moderna vaccines because that's one of the components in those 2 vaccines. And again, ask your doctor if you can get the J&J vaccine. And then if you're allergic to polysorbate, which is a component of the J&J vaccine, then you shouldn't get that vaccine. And you should ask your doctor if you can get Pfizer or Moderna instead. There is always a small tiny risk of anaphylaxis, which is a severe type of allergic reaction with any vaccine. And that's why everyone is observed for a period of time after getting any of the 3 COVID-19 vaccines. But yes, if you are concerned about a possible allergic reaction and you would feel more comfortable getting vaccinated after first speaking with, in this case, your child's pediatrician, we would absolutely encourage you to do that. Pediatricians are a great source of information regarding vaccination for kids. So thank you, Dr. Ferrer.
If I can add really quickly, Dr. Ferrer.
Of course.
When people are concerned about having an allergic reaction, one of the things that is done after vaccination, typically it's 15 minutes. But if there's a concern that a person may have an allergic reaction after being vaccinated, they'll observe for 30 minutes, which is really around the time that if there's really going to be a severe reaction, you're going to see within that time frame. So there are lots of precautions that are taken to monitor and make sure that people are safe before they go home after being vaccinated.
Yeah, thanks so much, Dr. Davis and Dr. Gonzalez. Dr. Tarasita, a few questions about this as well. Can the Delta virus and the Omicron virus combine to become a more dangerous variant?
Good question. We're talking about recombination, which is swapping of genetic material between viruses to create a new virus. And this is really how variants can be created. Usually variants are created either because of mutations or because of recombination, swapping genetic material. It's theoretically possible. I think that's what I'll say. It's theoretically possible. But if you've ever studied virology, you know that it is really hard to create what I'll call is a super virus. A lot of different random factors would have to come together in a very unusual way. It's possible. I wouldn't lose sleep over it.
Yeah, thank you so much, Dr. Tarasita. It's much more likely actually that viruses mutate, which is what we're seeing now, than that they actually do this combining. So we what we do worry about are the virus mutations, and we've seen these mutations now. Delta was worse than alpha and beta. So we have seen a history of sort of mutations really setting us back on our progress. So, and that's a very real possibility with all viruses, including COVID-19. Dr. Davis, I think there's a whole set of questions on this, and I think they're really good questions, and we certainly get asked them a lot with our partners, particularly at schools. With the coming of the Omicron virus, it seems that it's much more communicable. Shouldn't the protocols for testing and social distancing and quarantining be revised, especially at schools?
So we actually have a lot of information. We have a lot of different layers of protection that have been in schools in order to make sure they're as safe as possible for in-school learning. And so far, we've had pretty good evidence that the things that are in place are working and keeping the infections down and the transmission between students and staff down. Doesn't mean that it doesn't occur, but in general, we've had good evidence that the strategies that are being used right now are working. Now, if we go into a time period when we're seeing more Omicron and it's acting differently, it's behaving more aggressively, the protocols and the strategies that are in place are not working as well, then that's a time that, yes, some things may need to change, but not just in schools, but in other places as well. But for right now, it appears as if things are working, but we continue to monitor and we'll update as needed.
I think this is a really important question, and it's very hard on all of us, when we have to change our guidance, change the rules, change the safety measures that we're suggesting. I think you could look at this in a more positive way, though, which is, as we learn more about the virus and how it interacts with us, it is appropriate, and you would want us to be using that information to make those changes. So, every single day here at the department, there's, really dozens and dozens of people that look at all of the data, the information we get from the schools every day about how many people are infected there, how many of those people who were infected actually transmitted the virus at a school setting as opposed to a community setting. We look at all of the information coming from our workplaces. We look at information from other parts of the world and other parts of the country, and then try to stay on top of the scientific research to say, this is a time where it's important for people, for example, to wear their masks whenever they're indoors. Months ago, we reinstated that indoor masking requirement, not because we wanted to really, bum everybody out or create hardships for people. We know how sick everyone is of wearing a mask, but because we saw the data and it said that people who were fully vaccinated were starting to get infected and they were transmitting to others. And in many places, you had no idea who was vaccinated and who wasn't. So it made a lot of sense, and it still makes a lot of sense for us to keep that extra layer of protection on, even if we're fully vaccinated. The same thing happens at our schools. I want to note, like right now, if there's an outbreak at a school, and that's a situation where we know that there's been transmission, one person at the school has infected a couple of other people at the school. So it's not that lots of different people got infected elsewhere. and happened to get tested and we found out they were positive, but it's that they're actually passing on the infection in a school setting or school activity. One of the first things we do is we go in and we change the rules around quarantine. And we don't allow, when there's an outbreak, people to sidestep that quarantine process. We ask people in those situations to really stay home for the quarantine period so we can make sure we don't continue to see a lot of spread at the school site. But I think it's a great question, and I appreciate the opportunity for us to be honest and say, pay attention with us to the data, because when things go bad, we have to think about how to layer in more protections. So this was a really good question because you're obviously watching our data and you're seeing that our cases are going up. And we're going to continue to look very carefully at what it is that we all need to be doing and how well we're then doing it, so that we can try to get back to having less transmission than what we have now. Dr. Gonzalez, I'm 70 years old and I had the booster at the very beginning in August. It'll be 6 months coming up in January, February. Should I be getting another booster then?
Well, first of all, that's great. This person's been vaccinated and boosted. So yay for that. We do encourage everyone 16 and older to get a booster dose, and it's especially important for people who are 65 and older or those who have underlying medical conditions. But as Dr. Davis and Dr. Tarasita both mentioned, only one booster is what's recommended at this time. And just again, as a quick review, boosters are recommended as a one-time shot, either 6 months after receiving your second dose of Pfizer or Moderna, or 2 months after the single dose of J&J. Importantly, aside from strengthening your protection, Delta, we're seeing that the booster doses also provide increased protection against Omicron. So I don't know, Dr. Davis and Dr. Tarasita, if you would like to add anything?
No, that was perfect.
Well, we'll go to Dr. Tarasita anyway with another question. Since I've heard that the new variant causes just mild, insignificant symptoms. So why are we making a big deal about this, wearing our masks more, and asking for more people to go ahead and get vaccinated? Doesn't seem like the vaccines are working that well, and this is more like a cold than any serious illness.
Yeah, this is a really good question. Why do we care about Omicron? And there's so many reasons why we care about Omicron. I'll just start to list them. We know Omicron is more infectious. Like, it transmits very easily, maybe as easily as Delta, maybe more easily than Delta. We're still learning a lot about the virus, but it transmits quickly from person to person, right? We also know that it eludes the vaccine. Like, the vaccines just don't work as well against it. They work a little bit, but they don't work as well, which is why our other mitigation measures, such as distancing and wearing our masks, become so important, because even if you're fully vaccinated, you could still be exposed and get the virus. Now, in many people, it has been causing a more mild or insignificant infection. Some people are asymptomatic, but that's just based on preliminary studies. We don't know. A lot of the initial people who were infected were people who were younger, were people who were travelers, so they're inherently more healthy. And maybe these individuals just didn't get as sick because of their underlying immune status. Additionally, we know that even if a lot of young, healthy people get it and don't get very, very severe symptoms, that when older immunocompromised individuals get disease, they do become more severely infected, and in fact could die. So many reasons why you want to continue wearing your masks right now. Additionally, masks will help against all the other respiratory viruses that are circulating, flu, all the other viruses, which can compound and complicate any respiratory infections we have right now. It's a good idea, as our numbers go up, we're entering a new surge, that we continue to wear our masks, protect each other.
Thank you so much. Does anybody want to add? Couldn't tell, Dr. Davis, if you wanted to jump in.
Just to add that, the the folks that we're seeing right now, as Dr. Tarasita mentioned, many of them were travelers. And internationally, when you travel in a lot of countries, you have to be fully vaccinated. So we may be seeing some of the protective factor of the vaccines against severe illness. So as more people become infected, we'll learn more, and especially as more unvaccinated people become infected, we'll learn more about the true nature of the Omicron variant. But for now, this is an early sample, probably a biased sample, meaning it's tilted towards one group that's more protected from severe illness with the vaccines, but more will be learned as time goes by and more infections actually occur.
Yeah, thanks, Dr. Davis. I'm going to stay with you for a sec. These are some questions that have come in about our regulations. So the first one here is, if I decide to conduct testing for all employees coming into a meeting at my work location and everyone is negative, can we remove our masks and conduct our business without having the mask on? Are there any regulations that prevent me from doing this?
Yeah, you can't do that. There are both state and our county requirements that require indoors that everyone wear masks regardless of vaccination status. And again, this is that additional layer of protection as we're indoors, where it's more likely that the virus, if someone is infected there, will spread. Again, we've talked much about the vaccines and effectiveness and the different strains that are circulating. But no, at this time, you can't do testing and have everybody tested and fully vaccinated and say you can't wear your mask. It's not a prudent thing to do at this time. As you know, our transmission is going up, and we do have people who are fully vaccinated who are also getting infected. They may not have as severe outcomes. Their risk is less because they are fully vaccinated, but we can't keep having this number of infections or them keep going up, because that's how we get variants. So we need as many layers as possible to try to prevent infection and spread between people.
Thank you so much, Dr. Davis. Dr. Gonzalez, we have a whole set of questions that started coming in really about side effects, reactions, worries that people have around the COVID-19 vaccines. So I want to start with this first one are there some current studies regarding menstrual cycle changes after receiving the COVID-19 vaccine? And will these vaccines affect my fertility?
It's a great question. And yes, I've been hearing that quite a bit myself in the community, rumblings about that. Earlier this year, actually, the National Institutes of Health awarded 5 institutions 1-year grants totaling over $1.6 million to explore potential links between COVID-19 vaccination and menstrual changes. That includes researchers at Boston University, Harvard Medical School, Johns Hopkins University, Michigan State University, and Oregon Health and Sciences University, all of whom will investigate whether these changes in menstrual cycles that some people have been reporting, if they may be linked to the COVID-19 vaccine itself, or if they're just coincidental. The mechanism underlying the vaccine-related changes, if any, and how long any of these changes last. Like I said, we have heard some people report a change in their period after getting the vaccine, including things like heavier flow and painful cramps. We don't yet know if these changes are due to the vaccine specifically. Menstrual changes were not reported in the vaccine trials, and no studies from these that have been funded by the NIH are available yet for us to review. But it's important to remember, actually, that many things can cause a change to menstrual cycle. Things like stress, changes in sleep, diet, exercise, and some medicines. And irregular periods are very common among teens and may also have no specific cause at all. But if you have concerns about your period or your child's period, again, repeat what I said earlier, we always encourage folks to talk to their personal medical doctor to get their questions and concerns addressed specifically.
Yeah, thank you so much. I know that so many people are worried and appropriately. For women, we know our bodies are different. We worry a lot that people forget about that, and we have enormous responsibilities because of our reproductive abilities. So, we really welcome all of your questions, and we really thank you for lifting this issue up to all of us, and obviously to everybody who's listening, because we know lots of people have questions about this. And sometimes people are afraid to ask these questions. They feel like it's very personal or should be very private. But we can tell you questions about fertility, menstrual cycles, these are the most common questions that people ask us. So thank you for raising those up. And again, we know also, because they're such common questions, that the country's invested money in trying to get better answers for folks by doing more rigorous studies on these issues. There are also lots of studies that have been done looking at the fertility issue. I don't know, Dr. Gonzalez, if you want to just talk about sort of the many myths that are out there that really have really spread very quickly about the fact that the vaccines cause people to be infertile, they cause people to lose their babies, they make it impossible for people to get pregnant. So maybe this would be a good time to clear that up as well.
I'd be happy to. Thank you. Yeah, so we've heard many women, including women who were part of these early studies before the vaccines were even authorized for use, that, many women have become pregnant after being vaccinated, have had successful pregnancies, have had healthy babies, had no complications from their pregnancies whatsoever, either to their personal health or their child's health. So there, at this time, is no link that we've seen between bad pregnancy outcomes and being vaccinated. Vaccines appear to be actually very safe from everything that we've seen so far in the community. We've also seen people who have been vaccinated prior to being pregnant, and like maybe the following year had a pregnancy, and again were able to be pregnant. First of all, they were able to conceive, to become pregnant, and to stay pregnant and have those healthy babies. So there haven't been any studies that we've seen so far that link either vaccines with either, like I said, bad pregnancy outcomes or with bad birth outcomes for the baby. In fact, what we've seen is the opposite. When we see women who are pregnant and they actually are unvaccinated and get the actual COVID infection, those are the women that we see having the worst pregnancy outcomes. They can even have early labor, preterm labor. And, so we really don't want women who are pregnant and that pregnancy actually puts them at higher risk for bad outcomes should they become infected. We want to protect our women, our future babies, and we can do that best by having moms either vaccinated during pregnancy if they haven't been vaccinated prior to becoming pregnant, or either during pregnancy or ideally before pregnancy. One other thing that we've seen also in the studies is that we've seen if mom is vaccinated, her antibodies, her circulating COVID-19 antibodies are found in the cord blood. So it appears that those antibodies are actually being shared by mom through the umbilical cord to baby. And so that could be protecting babies from potentially being infected or having bad outcomes as soon as they're born as well, because mom is passing along her protection to them at that point. So that's what we've seen so far. Not really any negative links with the vaccines and pregnancy, but definitely we've seen negative outcomes from infection during pregnancy.
Yeah, thanks so much. And then maybe I'm going to stay with you for another second, Dr.
Ferrer.
Gonzalez. Yep.
Sorry, I don't want to forget our men in this.
Go right ahead, Dr. Davis.
The research has found no significant changes in the sperm characteristics of men after vaccination, so no impact in that regard. There are times if you're really hot, you have a fever, if you're ill, you could have a short-term decrease in sperm, but nothing long-term. And so there isn't any evidence that the vaccines cause male fertility problems either. So thank you.
Super helpful. Thank you. Thank you, Dr. Davis. You're on a panel with a lot of women, so we appreciate your jumping in on this. But back to Dr. Gonzalez, just because related to this is, should my pregnant wife get a booster? She got vaccinated before she became pregnant. It's time for her to get a booster, but we're not sure she could get it.
Yes, I absolutely recommend her to get a booster shot. Again, as Dr. Tarasita pointed out, our strength of our antibodies, our immunity overall, over time starts to decrease, right? So we've got really good protection after our first and second doses, but over the months, the antibody level begins to wane. And so getting a booster gets you back up to ideally where you were after your second dose, or maybe even higher. So absolutely, in order to protect mom, and your baby, I would absolutely recommend, and I'm sure we would all recommend that you get, even you've been already got your primary series prior to being pregnant. Now that you're pregnant, it is totally safe and definitely a good idea to get the booster now. The sooner the better. Don't delay.
Thank you. Dr. Tarasita, I'm going to shift a little bit because we have some questions about therapeutics. These are medicines that people can take if they end up getting infected. These are thoughtful questions from people who fully vaccinated and even boosted, but know that they have a greater risk now of possibly getting infected. And they want to know, what are the pills that are going to be available or already available, or medicines or infusion therapies that can be part of a treatment if they get infected with Omicron?
Thanks, Dr. Ferrer. This is actually some good news on the COVID front. There's a lot of new therapies that are coming out. There's 2 new oral therapies, which I think the person who asked the question is referencing. One just came out, molnupiravir by Merck, that came out and is intended for treatment for those of a certain category. So it's those who are still outpatients, so not very severe COVID, who have some sort of risk factor for becoming a severe COVID case. There's another oral treatment coming out from Pfizer, ritonavir or Paxlovid, that is not authorized yet, so we're still waiting. Don't exactly know what the authorization will be for, but I suspect it'll be similar to the molnupiravir, but we'll see from the FDA when that comes out. There's also a number of monoclonal antibodies you may have heard of, and these are mostly infusions or injections, and you can get these from, again, your physician for a variety of different reasons. There's treatments for when you're in the hospital, there's treatments for when you're outpatient, and there's also treatments for before you even get infected, so what we call a preventive preparation or treatment. So it's confusing. I would talk to your doctor if this is something you would be interested in. They all have to be prescribed by a physician, but it is good news that we have a lot of options out there.
Yeah, thank you so much, Dr. Tarasita. Dr. Davis, this again is a question that's come from multiple folks who are listening tonight. Do you have immunity if you've had COVID-19, and how long does that immunity last? I'm going to give them all to you. How long does it last? And should you be getting vaccinated?
So, like with most illnesses, you'd have some protection. Your body builds up some ability to fight infection. However, it's not quite clear how long that protection lasts. What we do know is that when they looked at a comparison of people who had previously been infected with COVID-19 and they looked at reinfection, for those who were previously infected and got vaccinated, they were much less likely to get reinfected with COVID-19 again. So there is benefit to being vaccinated over just the natural protection that you may get from being infected. And that's one of the key reasons why the CDC and others have recommended that even if you were infected, it's better to get vaccinated in order to really boost your immunity and your protection against getting reinfected.
Yeah, thanks so much. Dr. Gonzalez, there are some just questions about antibody tests that have just come in. What's the use of an antibody test? So I don't think this is the antigen test that Dr. Tarasita talked about earlier that helps determine whether or not you're positive with infection from COVID. But these are questions about antibody tests, and I'm wondering if you could talk a little bit about when we use an antibody test, what it can tell us, what it definitely can't tell us, because this person wants to know where they should be going to get their antibody test.
Well, antibody tests are lab tests. They would be a blood test. So you would need to get that ordered by probably your primary care provider. But actually, we don't recommend antibody tests. And the reason is because we know that the vaccines actually do trigger a good, strong antibody response. So just the fact that you got vaccinated tells us that, you're more than likely going to have those antibodies developed. It's very, very few the people who actually don't get immune response, positive immune response to the vaccines. But the other reason why we don't recommend them is because antibodies are one piece of the the overall protection that your body builds in response to a vaccine. You also receive cellular immunity, right? So these are white blood cells, memory cells, T cells that actually also help along with the antibodies to protect your body. And those are not captured or measured at all in the antibody blood test. So there aren't really good tests to test how strong your cellular immunity is at this time. Maybe there will be at some point in the future, but it's really not a very useful thing to do to measure your antibodies. It's much better to just go ahead and stick with the actual regimen of the timing of getting your primary series and then the booster to just sort of have that sense of security that, yes, you have the full immunity, both antibody and cellular.
Dr. Tarasita, a question just to build on the information again. Let's talking about testing. How do I know if I've tested positive? How will I know if it's Omicron?
You won't. If you just go to a lab and get tested, they will just tell you like positive or negative. The only way to test for Omicron is to do further lab studies. So it has to be done at a more specialty lab. They have to do what's called whole genome sequencing. So some labs automatically will send your specimen to get whole genome sequencing, some won't. If you're curious or you're very concerned, I would talk to your clinician and get something ordered through a clinician. Our public health lab will do whole genome sequencing to detect Omicron, which is one of the reasons why we've detected Omicron in our community. We also partner with a number of different reference labs, which will do them also. But your general test that you go to a testing center or you do at home, that is not going to tell you if you have Omicron.
Yeah, it's such a good question. There are, for a county, we do, that specimen additional sequencing for lots of the tests, but we do them generally for some very specific situations. Like if we have a large outbreak, we may want to know more about that outbreak, particularly right now, whether it's, fueled by the Omicron variant or it's still Delta. The main purpose to do the sequencing is to figure out what proportion of the cases that are positive here may be attributed to Omicron versus what's been circulating so far as Delta. The truth of the matter is, if you're positive, what you need to do stays the same, whether it's the Delta variant or it was some other variant that we had before, or it's the new Omicron variant. Like, if you're positive, what you need to do is the same. And over the next few weeks, Omicron is going to be more present here. So we all need to know, if we test positive, that it's even more important now than ever before to make sure we isolate ourselves for at least 10 days. Plus, if we need more time because we have symptoms, then it's got to go on until we really don't have a lot of symptoms or fever. And if we're close contacts, we need to take seriously the obligation to quarantine. In both those situations, you're taking yourself out of the mix of interacting with other people so that you don't have a possibility of passing on the infection. That stays the same whether it's Delta or Omicron. The importance of making sure that when you're positive, you're not going to pass on that infection to others. Lots of people think, no big deal. I don't feel sick. I'm going to put my mask on and I'm going to do what I want to do. And that's at this point irresponsible. I'm just going to be straight about it. It's irresponsible. If you're positive, you need to stay out of circulation. It's very easy to shed virus, particularly with Delta and now with Omicron. So you really need to respect our need collectively to not be spreading. So people who test positive, whether you don't need to know exactly what variant it is, you know that you are testing positive for COVID, and you have to take those steps to protect other people from getting infected. So we ask everyone to do that. But we understand lots of people want to know if it's Omicron. Because for many people, they're like, oh, that would be more serious. But what we're trying to say is it's super serious right now. The increases we're seeing in our cases right now, the increases in the hospitals, we've had more than 100 new admissions just in 1 week alone every day. Those are fueled by the Delta variant. Okay, this reflects how we all behaved back in Thanksgiving when there wasn't that much Omicron that was circulating in our communities. So let's just be wise about this and go ahead and take those steps. I want to go ahead and Dr. Tarasita, I just want to stay with you for a second around, what causes protection at this point. So this is about both for young children or younger children who just completed their 2-dose series, but also adults who just completed their initial series. People are pretty worried because they hear us say you need to get a booster to get the additional protection from the vaccines. But what if it's not your time yet to get a booster? Most kids 5 to 11 are just completing the series. And frankly, we know in LA County, lots of adults are just finishing their initial series. Are they protected against Omicron, or are they in that group that you mentioned that's like 30 to 40% at best protected?
Yeah, that's a good question. And I think Dr. Gonzalez actually touched on this earlier too. You are actually most protected when you get the full dose, full series of vaccine, like 2 weeks after you get that series, the last dose. That's when you're most protected. And then it starts to wane or decrease over time to what a lot of the studies have recently shown, maybe 5-6 months out. Your protection against Omicron drops really to like 30-35%. Delta, it still stays up, but for Omicron, we do see a large decrease in the efficacy of vaccine. But if you just got your vaccine, that's the time you are most protected. You should still be very careful. And now is the time to be careful. We don't want to get ourselves and our loved ones sick. Wear your mask, especially when you're indoors, physical distance. Test yourself, test your friends and family if you're going to gather without masks because you're eating or something. Be smart, use common sense and protect yourselves, because we are in the beginning of a surge. We are at the beginning of other respiratory disease season, and we have Omicron circulating. So please continue to be smart.
Dr. Tarasita, I'm just going to stay with you for just a second more, if you don't mind. This is a question now about boosters for 12 to 15-year-olds. Many of them are now about to hit the 6-month mark since they completed their primary series. They need their boosters. That's what this parent is saying. When is that child of mine going to be able to get their booster?
Yeah, that's a good question. And for everyone who wants a booster faster, there's someone who wants, the vaccine slower. Slow down. You need to make sure these are safe. And so we really try to honor that. Like we look to the science, we look to the researchers who are making sure whatever they recommend as far as vaccine or boosters is safe in the population. They're recommending this. It's a very, very rigorous system, which I believe in, to keep us safe. So long story short, the booster doses for the 12 to 15 are not recommended yet. We are all watching closely. I don't know when that'll happen, but we want to make sure things are done properly and things are done safely. I don't know if my colleagues know any more about when that might happen.
We have heard that obviously everyone knows the importance of doing those reviews as quickly as possible, but Dr. Tarasita is absolutely right. No corners are going to be cut when those reviews are happening, and they need to have enough evidence to make them feel comfortable that in 2 ways, not just that it would be safe to give a booster dose, but that actually younger teens need a booster dose. One thing, lots of people have asked us, oh, why are the 5 to 11-year-olds getting so much of a smaller dose of Pfizer? It's because their immune systems work differently. People have said, oh, my child is 11, but they weigh as much as my 16-year-old. Shouldn't they get the dose for a 16-year-old? But it's not based on weight. It's based on the age of young children and younger teens and how their bodies in general react when their immune systems are prompted. So we have to get both those questions answered. Do our younger teens need to get boosted? And then is it safe, and when is it safe for them to get those booster doses? So that's why we're blessed in this country, because we have two entirely separate departments, agencies that will be reviewing all of this data to make that decision. We have the Food and Drug Administration and we have the Centers for Disease Control. And both of them have independent scientific advisory panels that also weigh in on looking at all the research. So it will take some time, but I think we can then feel comfortable when the decision is made that people have looked that experts have looked very carefully at the information before they've made that decision. Dr. Davis, I want to go to one more question really about, sort of staying safe before we are going to switch. And maybe this is either for Dr. Gonzalez or Dr. Davis, before we switch over to a whole host of questions around regulations. But this is an important question. And I know we just updated our guidance about how to be safe when you wear your mask. Should we switch from cloth masks to surgical or N95s or KN95s? Frankly, I'd rather wash and reuse than dispose, but I'm hearing that cloth masks don't filter as well as both surgical masks or KN95s or respirator masks. So anybody can jump in on this. I know we've been writing guidance for the last 2 days about this, and the state has also issued new guidance. But Dr. Davis, why don't we start with you, and then other people chime in for sure.
Sure. So there are two things that we talk about when we talk about mask, and one is that it has a good fit and that it has good filtration. So if you want to wear your cloth mask, probably the best way to have that is to actually have a surgical mask underneath it and have the cloth mask over it. So it does improve the fit and also improves the filtration in terms of having multiple layers and different types of layers in terms of the mask. Now, if you want to go to a higher level of protection as well, using an N95 that is well fitted on you and not too big, not too small, that the seal around the edges, around your face and your nose are very close to your skin or tightly on your skin, that is another way to go. That's naturally built to filter out more, as well as a KN95 that's been assessed by NIOSH in terms of it being well protective as well. So those are the best recommendations around that in terms of using a cloth mask, again, double masking, surgical mask underneath the cloth mask to improve that fit and the filtration. But I open it up to Dr. Gonzalez or Dr. Tarasita to add.
No, I have nothing additional to add, Dr. Davis. Thank you.
I agree. That was good. Thank you.
Great. I'm gonna go ahead and Dr. Gonzalez, anybody can really weigh in on this question as well. Where in LA County do I have to show proof of vaccination? And should I be carrying my child's vaccination card with me as well?
Great questions. So you don't actually have to carry vaccination cards themselves. There's a lot of electronic things that you even QR codes and proof of vaccination that you can carry on your cell phone, both for yourself and for your children. Of course, you can carry the actual cards themselves, but some folks worry that they may damage it or potentially lose it. So a photo of your vaccination card works just as well as the actual vaccination card, or you can get one of many different QR codes, depending on where you got vaccinated. You often would have gotten maybe a text or an email If you provided that information when you got vaccinated and you would have gotten a prompt to access a website where you can access that electronic record, you can then often download into your wallet, either it's an Apple wallet or a Samsung Android wallet. So you are able to have non-paper versions of to be able to show when you're asked for proof of vaccination. Now, as far as where do you need to show it, that varies. So LA County is huge. It's over 4,000 square miles. We have, over like tons of dozens and dozens of cities. So everyone can independently have their own rules about and requirements about where and when you're expected to show vaccination. The general rule of thumb I would say is just be prepared, bring your ID, and have that proof of vaccination, either the hard copy paper version or the electronic version on your phone, to be able to show when you are asked for it. But it's going to vary depending on where you are. Generally, if you're going to be going somewhere indoors, especially somewhere indoors where you're going to be taking your mask off because you're going to be eating or drinking, such as a bar or a restaurant, generally they're probably going to ask you for that proof of vaccination. Kids often are asked for proof of vaccination also when they're going to participate, particularly in youth sports settings. So it just varies. It varies on the setting and the city where you're going to be required. So probably best to just check your own city's local requirements, and even better just to be protected by having your ID and having your proof of vaccination at the ready, just in case you weren't anticipating someplace asking you for it, and then they do, at least you're prepared ahead of time.
Yeah, thanks so much. I do want to clarify, there actually are some rules that apply across the entire county. So let's make sure that people understand that regardless of what city you're in, there's sort of a basic set of rules around vaccination verifications at some places that everyone has to follow. So the first is for healthcare workers. All healthcare workers and all workers in healthcare facilities in LA County are required to be fully vaccinated. So if you're in a hospital, you work in a clinic, you're a home health aide person, you're an EMT, you're all required by a county health officer order to, in fact, be fully vaccinated. If you are going into any bars, nightclubs, lounges, wineries, distilleries, breweries in LA County, in any city in LA County, you must show proof of full vaccination, and so must the employees who are working in the indoor portions, or the customers who are going to be in the indoor portions of those facilities. So wherever you are in the county, if you're going to a bar, you're going to have to show full proof of vaccination in order to go in and to go into the inside areas. And the same holds true for employees there. If you want to go to a mega event, these are events that indoors are 1,000 or more people, or outdoors are more than 10,000 people. You're going to have to show either proof that you're fully vaccinated or that you've had a negative test. And as a matter of fact, the windows for those tests now are pretty narrow. You can have a negative test result with an antigen test, but that has to be within 1 day of entry, or 2 days if you got a PCR test. So that applies wherever you are. LA City, which is the sort of a huge area in LA County, also requires vaccination verifications. You must be fully vaccinated to go into restaurants, entertainment venues, movie theaters, personal care establishments. I don't know, Dr. Davis, help me out. I mean, it's a long list for LA City. So I think Dr. Gonzalez said it best. You should think about getting fully vaccinated if you want to be around lots of other people in these indoor spaces, because many places across our county will require this. There is a lot of variability because cities can add more restrictions or add additional mandates, but there is sort of this place where everybody in the county is going to be aligned. But Dr. Davis, what did we leave out on this?
Sorry, so you talked about restaurants, you talked about beverage establishments, gyms, fitness centers, entertainment and recreation venues.
I didn't talk about gyms, so.
Okay, personal care establishments, so body art, piercing, spas, nail salons, etc. and then any indoor city facilities that include city halls, senior centers, recreation centers, and service centers.
So maybe I could stay with you for a second, Dr. Davis, because I think this, again, I've got this question multiple times tonight. If we have to verify that we're fully vaccinated in order to go in to a gym, why do we still have to wear a mask? When are you getting rid of the mask mandates? They've gone on too long.
And we've also have infections increasing. So, when we put it in before the state put in the requirement for indoor masking, regardless of vaccination status, we were pretty clear that we did it because we were, in substantial and high transmission, or if we got to high transmission. We're currently in high transmission. And so at this point, we need multiple layers to try to blunt what we might see. And hopefully we're avoiding, a winter surge like we saw last season in terms of winter season. But we want to get to a place where community transmission of COVID-19, regardless of what is circulating, is at moderate or lower. That gives us evidence that there's not as high of a risk. But when you have this much transmission, during this time, especially as we go into winter season, where respiratory viruses like influenza, like RSV, like any of those viruses, adenovirus that go circulate during this time, we have to have multiple layers to protect. And so that's where we are at this moment, and that's why the masking requirement is still in place.
Yeah, I think it's important for us to all remember back to last winter. We had a lot of cases, and when you have a lot of cases, it results in a lot of hospitalizations. And our hospital system couldn't really withstand the stress. So I know people are frustrated and they feel like, well, let's just take some risks. But those risks, unfortunately, of having lots of cases translate to maybe stressing out the hospital care system again. And that doesn't just mean that care is compromised if you've got COVID. That means care is compromised if you need other things. If you have a heart attack, if you're in a car accident, if you have a scheduled surgery, it gets delayed for 2 or 3 months. So we all suffer if we overstress, overtax our healthcare system. And even right now, we have, as I noted, over 770 people in the hospital today with COVID. Our hospitals are really full already. So they can't really stand having, remember last winter we had 8,000 people in the hospital one day. We can't go there, across our county. We don't have that kind of capacity. And it means all of us have to be extra cautious. So I know it sounds like everybody's vaccinated, but we've shown you data every single week about how many people who are fully vaccinated still can get infected and still can pass on infection to others. So for right now, when we're seeing a significant increase in cases that results in an increase in hospitalizations, we're going to continue to keep those masks on until community transmission levels are pretty low, and then we don't have to worry as much about infecting other people, particularly if we're fully vaccinated. I want to ask the last question that we're going to have time for tonight, and let me reassure people, we've got all your questions. We'll go through them and put them in different categories, try to post answers to the themes that you're raising on our website. So if we didn't get to your question, first, thanks a million for sending us the questions. All of the questions we got tonight were really important questions, and we'll get them answered and posted over the next few days. But I'm going to take this last question because I think it's in this spirit that we want to leave you this evening, which is, what safety precautions should we take if we're gathering with family and friends who are non-household members for Christmas? We plan on testing each person with these home kits that we told you about, and everyone is vaccinated and where appropriate, boosted. But what else can we do so that we can be safe? And I'll start with Dr. Gonzalez, and then we'll go to Dr. Tarasita and Dr. Davis, and we'll all give our advice and maybe even share how you're going to deal with this, because we all will be celebrating holidays as well, and we're making the same difficult decisions that you're making about how to make sure we keep each other safe. But Dr. Gonzalez, let's start with you.
Sure, yeah, great question. And actually, yes, I'm applying those same things in my own household for my small gathering with just a few family members. Everyone's getting tested, everyone's been vaccinated and boosted. Um, we do have a family member that's actually just recently been diagnosed as immune compromised. So I'm going to ask everyone, and at least that comes to my house, to actually also wear a mask, even though we're going to be eating and drinking. We're not going to be doing it 100% of the time. So asking everybody, when you're not eating and when you're not drinking, please wear your mask for everyone's protection. And, when you're not wearing it, trying to stay spaced out a little bit. So if we are eating, maybe we're eating in a couple of different rooms. So there's a couple of more opportunities for people to be a little bit more distance. Everyone, washing their hands, making sure that they are, making as little contact with each other as possible. I know it doesn't sound fun. We miss everyone. We want to hug and kiss everyone, but at least in my household, that's probably not the best idea, especially for my immune compromised family member who we really love and want to protect.
Yeah, that's so helpful. Dr. Tarasita?
Yeah, good question. Because we all want to be together, especially during the holidays. And there are ways to do it safely. I hope we really communicate that. I like what Dr. Gonzalez said. In my house, we also, everyone, when you get there, you wash your hands. Just something I do. I've always done that with my kids, but now we do that with everyone. Just wash your hands. We also have Purell laid out as if they're decorations, so people can wash their hands often. I do. For me, the most important thing is that everyone is fully vaccinated and boosted. So that's something that's very important in my household. And another thing we're doing is keeping it smaller. So really just close family and really no traveling. It's something I've kind of given up for COVID. And hopefully I'll be able to travel again soon, but at least for these holidays, no traveling. So that's what we're doing. And I agree with the person who asked the question. Those are very good places to start, and I hope you have a happy holiday.
Dr. Davis?
I mean, there's not much left to cover except for if you test positive or you feel sick, don't go. Stay away. Everyone, keep everyone else safe. Visit them virtually. If you don't feel well, and get tested if you feel like or you've been exposed and you might have COVID symptoms or whatever you're feeling. Get checked up by a doctor. But don't go if you're sick or you test positive.
Yeah, I think that's super helpful. I mean, one other strategy that works, because we live in Southern California, is you could do a lot of things outside. Maybe you can't be outside the entire time depending on what the weather is for Christmas or Noche Buena the night before. But for many of us, we can be outside for a good part of that, and we can try to move some of the eating and drinking outside as well. So that, again, ventilation is key here. So if you're going to be outside, that's great. If for some reason you can't be outside, then open those windows. You can run an air filter, do everything you can to increase the ventilation in your house, because that will help as well. And then on behalf of all of us here, and I want to thank Dr. Davis, Dr. Tarashita, Dr. Gonzalez, and I want to thank all of you for joining us tonight. But on behalf of all of us, we do wish you, your families, your loved ones, the absolute best for this holiday season. We're with you, and we keep you close in our hearts as part of this LA County family that we're all part of. And we want to also thank you and express our gratitude for everything you've done to keep each other safe. There's no way we get through a pandemic that's really what we now call a very long duration pandemic without all of your support, help, kindness, and caring for each other. So we're looking forward to a new year where, hopefully we can get back to slowing the spread. And we know that happens because we're in this just amazing community where people care deeply about each other and really understand that at this point, self-interest and selfishness have no place over this holiday season. We have to be about caring for each other. So with that, we're going to wish you all a good evening. Thank you. We'll be back in touch in the new year. But you also know, go to our website, get more information, contact us if you've got questions. We're always happy to answer your questions, and we look forward to being in your communities over access to vaccines and boosters and testing. We'll be distributing a lot of testing kits that people can take home in some of our hardest hit communities. We're working with the food pantries, we'll work with our shelters, we're working with community organizations that provide services and support to residents. So for those folks who are going to have a hard time being able to purchase those testing kits, we'll have some of those available. Also, there are 220 sites across the county. Almost all of them offer free testing. So go on the website, please get information and go ahead and get yourselves tested before you gather, travel, or if you've been sick or exposed. So thank you, everyone. Happy holidays. Good night for all of us.